Welcome, everyone. Honored to be part of this group. And um, Mike and Megan, thank you for sharing your story and your journey. I know it's difficult, but it's also probably feels good to share it with the group. And these diagnoses were the diagnosis we're talking about, in addition to all brain tumor diagnoses, is that they're difficult ones, and they carry a lot of weight, a lot of information that at first you have no idea about. And you step into this kind of tornado of activity, and you're given so many different pieces of information that you're trying to piece it all together. And that's where we come into play, and your providers, your medical experts that you trust are really there to help you along this journey. It's a difficult one, but it's a journey that can be done and can be done well. And I think these types of discussions are so important. So when it comes down to second opinions, what my feeling is, you should definitely get a second opinion. If you feel like you should get a third opinion, please do that. And in fact, I tell my patients, any provider who is uncomfortable with you getting a second opinion, you shouldn't be seeing that person, because second opinions really reinforce what me as a provider is instructing or informing my patient and their family. And it helps them understand the journey they're about to go on much better and feel more comfortable about it. Um, we talk about kind of expert centers of excellence in other areas that patients would like to go to get the best opinion. And I would say that you want to be seeking care from a place that's multidisciplinary. In other words, while there are neurosurgeons in different cities and hospitals, being part of a team that takes care of brain and spinal tumors is so important. And I think having, the neurosurgeon talk to the radiation oncologist, talk to the neuro-oncologist, the neuroradiologist, the neuropathologist, working as a team is really important. And many of the brain tumor centers and programs do that. So I think that's important in your journey in terms of, finding another opinion to discuss what to do. Our job is really as surgeons to keep you or make you better without hurting you during surgery, but also take out as much of the tumor. And I think that's so important with ependymoma, is the extent of resection and having the right expertise with surgeons, having the right tools to do that type of surgery is important. So, I know it's daunting, and when you first see that first neurosurgeon, make sure that you talk about the experience they've had doing this, the team members around them. And again, the second opinion is so important. And a lot of people go to bigger academic medical centers, which is fine. I mean, you could do that. I know Mike and Megan, you guys went to MD Anderson, great institution, and I think that's really important, to help with understanding how to proceed forward. In terms of testing, one of the things Kim had asked me to discuss, imaging for any type of brain tumor is so important. Understanding the extent of the tumor, involvement in the brain, the tracks around the brain or the spinal cord with ependymomas is so important, so that we can understand how to take out the tumor safely and, again, preserve neurologic function. So the imaging is very important. We also have to get imaging of sometimes the brain and the spine in certain cases with ependymoma. So that's something that we are intimately involved as the neurosurgical oncologist. After surgery, there's a bunch of things that happen in terms of testing of the tumor. We look at markers, different things that we now understand how the tumor can behave and respond to treatments. And I think that's something that we're in a new era with now, that patients are learning more and more about some of the research that we're doing, and some of the predictive markers that we can actually look at in certain tumors. So that's also very important after the surgery is done. Um, Some other caveats, when you go to surgery, we want to make sure that the team in the OR has the expertise for the surgery. We do monitoring in the operating room so we can make sure that your neurologic function is preserved during the surgery. So that's something that, you may want to ask your neurosurgeon, if they have that type of intraoperative neuromonitoring that's important, especially for spinal cord tumors. I think that's a key point that you may want to clarify with your providers and with brain tumors as well. So I think those are some of the highlights I wanted to provide. I know our time is precious here. I don't want to, take over the panel here, but those are some of the things that I would just keep in the back of my mind. And what I tell my patients, don't be afraid to get a second or third opinion. Very normal. In fact, again, your neurosurgeon should be okay with that and pleased that you're just getting some outside opinions to confirm what they're about to propose to you.